webinar today, Lumiere Cosmetic Vein Center, presenting on vein procedures, something for both my patients ahead of time as well as during the process. If they have any questions, hopefully this can help address a lot of different concerns people have or questions they have about the process. Very different to an inpatient operative process is we don't have to do general anesthesia. So with us, you're awake. You're able to discuss with us discomforts or concerns. We're going to address them immediately and help limit your pain. You'll be assessed, addressed, and helped by office staff that you see every day since you've been in this whole process. So very familiar. The beauty of this is then you've got a rapport already, and it's easy to discuss concerns you have. And this rapport helps make it easy to convey your concerns, and we can help address these expeditiously. Eat as we don't have general anesthesia. We don't have to worry about you having problems with food in your stomach with the procedure. We also want you to take all your meds as you normally would, unless explicitly instructed in the preoperative phase to not take them. I want you to take all your meds as you normally would. We don't need any adjustments or changes from the norm. We want you to adequately hydrate. The more water you drink, the larger your veins are. The larger your veins, the easier the procedure. The easier the procedure, the less pain for you and me. Less tortuous. Your conservative measures. This means compression, elevation, exercise, and hydration. Why? Because as we can try and get these veins to be less inflamed, the pain also can be improved. Not saying it can be eliminated. I'll never say procedures are without pain, but we can reduce it significantly if we can actually reduce the amount of inflammation. The longer we wait, the more time we have to potentially apply that intervention, but also the longer we wait, the worse the veins can get. And as a lot of my patients and I have discussed, the pressure in these veins may exceed the pressure in these compression stockings that you're using. So the stockings themselves necessarily obviously don't fix the problem, but they also may not be stopping the problem from its worsening. They may only be slowing it down. At best, we can hope that stockings stop its progression. At worst, we think it's stopping it, but it's not, and it's actually slowly getting worse, because what if the venous pressure is 60 and the stockings are 30? Obviously, it's still making blood still can get through those veins and still progressively cause worsening disease. Next, scheduling. Alternating procedures with ultrasound. We'd like to actually confirm that the most recently treated vein is okay before we proceed with the next vein. This is just to make sure that there's no problems, no complications, nothing that we need to worry about treating. We also recommend that our patients don't fly within 4 weeks of any intervention. Why? Because there is documented evidence of inflammation in treated veins for up to 4 weeks after a procedure. So obviously we don't want to put you at risk. We also say the same thing about 2 weeks by travel by car, but obviously you can get out of a car and walk around more frequently than you can in a plane. And also you don't have to worry about a pressurized cabin. We do recognize emergencies do happen, so if you have to travel by plane within 4 weeks of a procedure, we tell them obviously we need to get to whatever's an emergency, but recognizing we identify and educate our patients on risks of DVT, and if they did suspect this, they need to get an ultrasound urgently or emergently wherever they're at. Obviously we can always do it here, but this is always the concern and worries. There's somewhere else where I can't help them. Safety is our ultimate priority. For the actual procedure day, we ask the patients to show up at least 15 to 30 minutes prior to the procedure. If they are taking a sedative, we do ask them to come up in a little earlier, and then that way they can sign their paperwork and then take their sedative. If you're brought, or when you're brought to the operative suite, you're going to be positioned on the table in a recumbent position, supine usually. You may need prone positioning on your belly, but a lot of patients can't tolerate this. So we will adjust, adapt, and change our procedure positioning as needed. I've had even some people that could not even lie flat, so we actually had to have some people stand or be positioned in an upright position forward, but with the table up, so that they are almost sitting like this, and that's their access for the procedure. Prior to the procedure day of, your leg will be mapped. We're going to be looking specifically what's diseased at the time, because it can change from when we did your ultrasound to when we intervene. Obviously, not just because of the time frame delay, but also because of prior treatments. This changes the hemodynamics in your legs, and new veins may be visible now that weren't visible before that are bad. Please do not touch your leg or help with the drapes. I know every person wants to do this. I am included in that group. If I was a patient, I definitely want to assist and help, but it's now a sterile environment, so please do not touch the drapes as they're being put on you or after they're put on you. No procedure is painless. Most patients express their pain during the procedure are between a 1 and a 4. We do have some patients that have more than this, and obviously those are the ones that we help encourage with sedation. We have options of sedation that can be utilized, and during the procedure we use Pronox obviously as a laughing gas. Obviously Valium needs a little bit more time ahead. Regardless, between these two modalities, we can control most, if not everyone's pain. Topical and local anesthesia is used to help limit pain as well. Advantage of having conscious sedation, though, is you can talk to us. So as you have discomfort, we can slow down, we can abridge or abort procedures if needed, if it's too much pain. I'm not going to wood, have not had to do that, but ultimately that's always an option, that's always a possibility. We may need to treat these in segments. We may have to limit what we can do at each interval. But obviously, again, it's safety, comfort, and obviously efficacy of treatment. So wanting to make sure what we're planning on doing is accomplished. Much of the pain can be improved with regular preoperative use of compression stockings. The more compression you use ahead of time, the less inflammation around the vein. The less inflammation around the vein, the less the pain. I won't, again, say it's painless. The worse the vein, the worse the pain, meaning more inflammation. It obviously can cause more sensitivity and more pain. Next, wound care. Afterwards, completion of the procedure, you'll have a dressing on your leg that extends the length of the treatment. This will be layered gauze roll under an ACE wrap. Underneath that layered gauze, you'll have either steri-strips plus or minus an op site over the area where we actually access your vein. If it was a smaller access, it may only be steri-strips. If it's larger, it may require an op site. And it's also dependent on the type of procedure. If you have bleeding from the incision site, obviously hold pressure to help ameliorate it. If this doesn't happen after several attempts at trying to get the bleeding to stop, you can always come back to see us in the office. I'm on call and available for the office regularly. I've had to put stitches in sites and areas, and it's not necessarily because somebody's on anticoagulation. It can just be that there's a little tiny pressurized vessel that's there at the surface that needs a little more pressure. So worst case scenario, we have to put a stitch in, but don't let it sit there and ooze and ooze and ooze and ooze. Take down the dressing. Anything we've actually said in the form of a dressing during the procedure, saying 48 hours of constant compression. If you have any discomfort or concerns or worries, you can always take down everything. Look at what we did, leave the dressings intact as best as you can that are on the skin. But if you see a concerning problem, obviously try to address it. If you have any questions, you call our office, we guide you through it, or we bring you back in early. Anything that we need to make this easier. Let's see, next slide. You are using a sedative, you do need to be discharged to a responsible party or observed. The Pronox beauty is that you only need to be observed for a set amount of time afterwards before you can be discharged on your own free will, whereas Valium or anything else orally taken, you need to be discharged to a responsible party that can watch you afterwards legally. Next, nights. I'm available regularly. I've met patients here nights and weekends to help address, like I said, a bleeding wound or concerns and worries for DVT, and we can get an ultrasound in to just confirm that it's just the treatment area. God forbid it's something you're concerned with. I'd rather you call me 100 times and it be nothing than it be something and you don't call. So please call me if you got a problem. I deal with these calls all the time. I talk to my patients and walk them through this process. Common complaints, like I said before, pain, bleeding, dressing management, appointment times. We try to adjust, and change as we need to, and again, traveling. Patients have to travel because emergencies come up. Pain control, ice, Tylenol, ibuprofen, Motrin, Aleve, aspirin if you can, respective of allergies and ailments. Obviously, if you have those restrictions, you can. Topical diclofenac is great because it's like an ibuprofen that you can put over the wound that has help with inflammation along with the ice. We do have patients that have concerns with the compression and needing to look at the wound again, taking the dressing down and looking at everything to make sure it's okay. Next, let's see. Postoperatively, ultrasound is usually performed at 1 week. 5 to 10 days is the range. We need to have it long enough that if there's going to be a problem, we're going to see it, but not so long that you have a problem from it. That's realistically to make sure that the vessel is closed, but then there's no clots or complications associated with the closure. Obviously, God forbid, if there were, we initiate you on anticoagulation. Bring you back in 2 weeks, make sure the clot is gone, and then finish your procedures while you're on anticoagulation because you've shown a proclivity to clot. This does happen in approximately one patient out of 2,000. So the incidence is there, but it's rare. As we've done over 10,000 of these procedures, we've seen it happen a handful of times. Next, let's see. Chronic venous insufficiency, or CVI, chronic process. It's been present for decades, usually with many of our patients. With women, pregnancy, with anyone, it's heart or lung, liver, kidney disease can cause high pressure in these veins and cause worsened disease. From our initial assessment to completion of treatment, our usual course takes us approximately a year, and it's mainly because of the fact that you can't fix everything at one go. As we've closed everything, we give you a break, let things kind of heal, and then reassess. With that reassessment, we can see what still may be there that was kind of veiled behind that initial disease. And you can imagine, the bigger the vein or the bigger the river, it's going to take more of the flow. Whereas the smaller veins that are still diseased or bad that can be causing you problems are hidden behind that high flow large tributary. So it does take layers of investigation to see the whole picture. Some of our patients, it's an eagle, like we do our initial treatment, and that's it. We reassess at 1 month, 6 months, 12 months, and we don't see anything persistent, or find to sign off and say that she's good and okay to go. But some people would say, layers and layers and layers of problems. The heavier the weight, the heavier the pressure, the more the disease, the longer it's been there. It's developed layers of reinforcements within you. So it makes it harder to not just to assess it and treat, not just to treat it, but also to assess and see if it's there. It does take time to see the full picture. Let's see next. Symptoms in patients will continue to help you until we find the source of your symptoms. It does take time in some of our patients. I've got one patient, it took us the better part of 2.5 years and multiple procedures, but eventually we did get ahead of it and we were able to get control. This is where I talk about other medical conditions that do contribute to the problem. Anything that puts pressure on those that venous return can make this worse, and it's not just simply pregnancy. Anything and everything that can contribute to hemorrhoids, and so elaborate or extrapolate from all sorts of different medical issues. If difficulties with ambulating, it behooves us to delay or only treat with conservative measures for some of our patients when they have difficulty ambulating. Sometimes the answer isn't necessarily surgery. Sometimes the answer is conservative measures because they have a hard time with recovery. So it's not always a vein ablation. It's sometimes for some of our patients at least conservative measures until their situations have improved, or that might be their only treatment option. Questions? Hopefully this answers many of your questions. Any additional questions, obviously you can bring them up during our office visit. You can always bring them up at any point with me or the staff. If anything's pressing and really concerning you, or we need to delay, always keep us in the loop. Talk to us. Open lines of communication, because communication is the key. The only way we can fix this is open lines of communication, because I don't know what's wrong with you if you don't tell me. So I do everything I can to make this a very, very open and environment. This is Dr. Joseph Grano, Lumiere Cosmetic Vein Center, helping you understand our venous procedure processing, hoping to see you soon. Take care. Look better, feel better with Lumiere. Take care. Thank you.